After an auto accident, one of the most important things that's used to determine the value of the case or the settlement are the medical records or the doctor's notes. Unfortunately, there's some very common mistakes that are made in the doctor's records that could potentially lower the value of a claim or settlement. So I'm going to start a short series of probably about the 4 most common mistakes that happen in medical records that could potentially lower the value of a settlement or a claim. The first one is is linking your injury or the accident to your injuries. We call it causal relationship. 3 points should be documented within the records to prove this. First of all, there has to be a good description of the injury or the mechanism of injury. What we mean by that, besides just saying, well, I was rear-ended, there has to be some type of explanation of, how was the patient thrown around in the car? Did they feel the seatbelt tighten when they were thrown forward? Did they hit their head on the dashboard or the seat back? All these little factors are important because they tell us how the force was put into the car. The second point is there has to be a logical connection between the patient's symptoms or injuries and that mechanism of injury we just described. So, for instance, if the patient says, well, I've got headaches, but yet you understand from the history, they were thrown forward and then they were whipped backwards, striking their head on the seat back. Well, it makes sense why they might have some headaches. The third point that has to be addressed also in this causal relationship is there has to be no other logical reason why they might be experiencing those symptoms other than the auto accident. Now, to the patient that may sound simple, but it's really not. For instance, patients might have rheumatoid arthritis. They might have a history of migraines. They might have this whole other health history that has complicating factors that could make it a challenge. So the point we're trying to get at is from the very beginning, the doctor's notes need to be set up to tie the accident to the injury. We call it causal relationship, and it has to be done right at the beginning to help establish the foundation for the injury claim.